I want to thank everyone for taking the time to attend this webinar today. As many of you know, we take great pride about being comprehensive in the way that we practice financial planning at Allegiance Financial Group and focus on more than just managing our clients' investments, but also looking at some advanced planning topics, such as estate planning and helping our clients make sure that their loved ones are taken care of, tax mitigation, charitable planning, and risk mitigation. We do that by partnering with a team of experts such as CPAs, attorneys, and insurance experts. And our speaker today, Bryan Gay, is a member of our expert team, and he is a leader in Medicare insurance. He's the owner of Boomer Insurance Group, and for over 17 years, Bryan has assisted more than 6,000 clients and helped them make decisions about Medicare and other complex insurance topics. Bryan speaks at hospitals, Medicare educational events, and financial planning seminars. He is on numerous leadership councils for the industry's largest Medicare insurance companies, influencing the benefits of Medicare insurance plans. And given his background, he's been asked to testify as an expert witness in Medicare legal cases. I can tell you that I've had several meetings with Bryan and some of our clients, and our clients always love his approach and the information that he brings to the table and the help that he provides in helping our clients make decisions around Medicare has always been appreciated by our clients. And I'm sure that everybody that's on this webinar today will greatly benefit from the information he has to impart. So without further ado, I'll go ahead and let Bryan take the helm here.
All right. Well, perfect. Thank you so much, Saad. That's huge help, and appreciate the kind words. And we'll kind of jump right in, so people don't already fall asleep with this wonderful expression of Medicare. Thank you guys for joining. With the webinars, it's we don't see as many faces, obviously, and then on top of that, we do a lot of these in-person meetings too. So obviously, if you guys ever need anything financial or financial planning, talk with the experts, talk with these guys, because I don't know anything about finances or taxes. I say taxes aside because we've had so many people for some reason calling me and saying, I need to talk with Bryan about taxes. And I'm like, I don't know anything about taxes. So I've been obviously doing Medicare for many years. I probably do need to update my bio. It's now 23 years. So over 2 decades. So any question that you guys would have possibly relating to Medicare, just please put it in the question and answer. And at the end, we'll happily answer any question that you have. So with that, I'm going to kind of jump in to sharing my screen because it usually goes dark for a second. So while it's going dark, then I can also tell you a little bit more about my background and my company. So with Boomer Insurance Group, the only thing we deal with is Medicare insurance. So we don't do life insurance, we don't do car insurance. So we are subject matters experts in Medicare only. We do all the different plans with all these different companies. So, you've got United Healthcare and Humana and Cigna and Aetna and all these different companies, right? We don't have an allegiance to any one particular company. We have allegiance to the client. So we just figure out which one of those many Medicare plans is the right company for that particular person. And then on my side of things, personally, if you hear a bunch of really poor grammar, that's because I'm originally from Oklahoma. So we're not always known for the greatest of grammar out there. Sometimes we just make up our own words. But also, I was raised by a school teacher. Now, the bad news for you guys is she was also very sarcastic. So if you ever hear me say some things that are kind of sarcastic, it's pretty much all her fault. So I blame her for that. But she was also my grandmother. My parents passed away when I was very little, at 6 months old. And my grandmother at 68 took all 4 of us kids. So if any of you are approaching Medicare, typically Medicare is around 65, imagine you're already retired and at 68, you get a 6-month-old, a 3-year-old, a 10-year-old, and a 13-year-old dropped in your lap. So me being the youngest at 6 months, by the time I was 2, she was 70, and she was a single mom then at 75. and she passed away at 101. So pretty much the only people I've ever hung out with my whole life were in their 70s and 80s and 90s. So I've always just been very comfortable in this area, and then kind of stumbled across Medicare insurance many decades ago. What we're going to talk about today is the two main options with Medicare. So what we're not going to talk about are things that are extraordinary for other people may possibly have. And here's what I mean by that. There are some people out there who worked for the federal government, and those people have a totally different system that they're allowed to use, known as the FEHB, the Federal Employees Health Benefits. We're not going to talk about that today. If somebody does have questions about federal benefits, I can answer any questions about that, but just that would be more off on a personal phone call, not for today's meeting. Also, some people work for the military for 20 plus years, and those people are allowed to have a program called TRICARE for Life. We're not going to talk about TRICARE for Life today. Some people work for the state of Virginia or the state of North Carolina or some other state, possibly you worked for them, and they have a state retiree health plan. We're not going to talk about state retiree health plans. If you're in about 15 states, then I can tell you almost every single thing about a number of the states' health plans across America as well. But again, it's not prudent to what we're going to talk about today, because today we're only going to talk about what's available to everybody in the United States. Okay. So we're going to talk about, and then I do have a little slide deck here. So for those of you who really enjoy learning, I would highly recommend that you basically write down every single thing that's going to come on the screens as we go along. It's pretty short and simple. The best way to do it would be to have one sheet of paper for option number one and a totally different sheet of paper for option number two. Because at the end of the day, you only get two choices with Medicare that's available to everybody. So when the time is right, you're either going to choose option one or you're going to choose option two. That's the way it works. Now, just getting into Medicare is confusing already. Have you guys heard of that expression, darned if you do and darned if you don't? I'm trying to clean it up because Haley would yell at me if I didn't do it right. So darned if you do and darned if you don't, right? Well, that is Medicare. Have you guys ever heard about these penalties with Medicare? Because people like to tell their friends, you got to do this or you got to do that or you'll be penalized for life. Well, that is true for some people. So you're darned if you don't sign up for Medicare when you should have signed up at age 65. And some people who should have actually signed up at age 65, if they didn't do it correctly, and then later they go to sign up, yes, those people are penalized for not doing what they should have done when they turn 65. But then there's also darned if you do. If you actually sign up for Medicare at age 65 and you should have not signed up for Medicare at age 65, there's a different set of penalties for those people who should have not signed up but did sign up at age 65. Different people are under different circumstances. So what's right for one person might be completely wrong for your neighbor or your friend or even your coworker. So just make sure if people have specific questions about their own personal situations, happily answer any of those questions. But please don't tell people they have to or they should always, no matter what, sign up for Medicare at age 65, because that can get people in trouble. So, but eventually people retire or they come off of a group health plan and they come into Medicare. And they come into what I call the fork in the road. And this is when they have to make a decision between option one or option two. So we are systematically going to go through both of these options. And we're going to go based on today's average rates. This year, if it's ever recorded and seen at a later date, this is the year 2024. So if it becomes 2025 and 2026 and 2027, just factor on the rates going up because most things don't go down in terms of price. So option number one, this is where I'd have you guys start writing a whole bunch of things down on a piece of paper. So at the top of that paper, I'd have you write option one. And it's already going to get kind of weird because I'm going to have you write the word car up there in quotation marks. Now here we are talking about Medicare, and now we're talking about a car, like an automobile. Well, that doesn't make any sense. But if you think about it, it really will make sense. See, option one is like a car, right? It's more expensive to have your own car. Nobody buys a car to save money. We're going to buy a car because we want to go where we want to go, when we want to go, without any hassles, without any problems. So that's how option number one truly works. You can go to any doctor, you can go to any specialist, you can go to any hospital. As long as they just bill Medicare, they don't have to be in the network. They just have to bill Medicare, which is the majority of doctors. But with option one, you can go to pretty much any and every doctor in America and hospital and specialist without any problems. You're driving your car. You're going where you want to go. But it is more expensive. Now, typically more expensive, I'll say. With option one, you're going to wind up with 3 separate ID cards. And you're going to need to carry those ID cards with you. The first ID card that you take with you would be your Medicare card. It's a little red, white, and blue paper card that most people laminate. And Medicare is the only thing that we're going to talk about today that's through the government. So you actually buy Medicare through the government, actually through the Social Security Administration is where you sign up for Medicare. And eventually, you're going to need both parts of Medicare. So there's part A, like apple, and part B, like banana, apples and bananas. Well, part A is actually a separate insurance than part B. Okay. Part A is insurance for inpatient medical claims. So like if you went to the hospital, those hospital claims would go under part A insurance. If you went into hospice care, which is kind of like an end of life situation, hospice claims go paid for underneath part A insurance. Now you've also been prepaying for part A your whole life because it's insurance. We have to pay for insurance typically. So part A, you've been prepaying for it your whole life. When you do go to retire, as long as you've worked for 10 years or your spouse has worked for 10 years, you don't have to pay anything else for part A. It's considered paid up. But a lot of people say it's free. Oh my gosh, it's so not free. You've paid for 20, 30, 40 years into part A before. It's just you don't have to pay anything additionally later because it's paid up. Well, then there's part B, like boy, like banana. And you have not prepaid for part B. So right now in 2024, the monthly payment for part B is $174.70. Okay, so that's paying for part B. Now, what part B covers is outpatient services. So we're talking doctor's visits and CT scans and MRIs and outpatient surgeries, an ambulance ride. Even the emergency room is considered outpatient. So the majority of our bills actually fall underneath part B, medical insurance. Okay, but now we have part A. Now we have part B. We got Medicare. Well, how does it work? Well, at a high level, to keep it simple, well, you can see Medicare is going to pay 80% of your bills after you pay the medical deductible, $240. Now, I write this in first person because as you're writing these things down, it's easy to read it that says, hey, how does Medicare work? Medicare pays 80% after I pay my Medicare medical annual deductible of $240. Which, if anybody's on these high deductible plans, $240 deductible seems pretty reasonable. But you're still on your own paying your doctor bills, your blood work bills, you pay money to your specialists up to when you finally have paid out $240. The deductibles start again in January. So it is based on a calendar year. But then Medicare pays 80%. And then you're stuck with this leftover 20%. And the main problem is it's an unlimited 20% problem. So 20% of a doctor's visit ain't much. 20% of chemotherapy, that 20% in costs is astronomical. So we don't want to pay 20% of whatever bill shows up. So we buy these things called Medicare supplement plans. So Medicare supplement is the proper terminology. But if you notice, inside that little supplement ID card, it says Medigap. Medigap. Medicare supplement's the right term. Medigap is the nickname, but it's the same thing. Tomato, tomato, Medigap, Medicare supplement. Okay. These supplements are done through insurance companies. Like you would get a Humana Medicare supplement or an Anthem Blue Cross Blue Shield Medicare supplement or United Healthcare Medicare supplement. And you're going to have to pay for them. So since most of our customers today on the call, I believe, are in North Carolina and Virginia, then I would say the large majority of people who are turning 65, I didn't say 75, for most people who are about that 65-year range in those two states, your monthly payment is going to be around $120 a month for a Medicare supplement plan. If you want to put 120-ish, you can do that. But it might be 130, it might be 110. It just depends on your zip code, your age, your gender, all kinds of things. But again, we're trying to keep this simple as possible. All right, well, now that you donated some money to an insurance company, about 120 bucks every month, how does it work? Well, that supplement plan is going to cover all the 20%. They have to cover it. By law, they have to pay the leftover 20%. Well, even simple mathematics, being from Oklahoma, if somebody else is paying my 20% and somebody else is paying my 80%, that means I'm 100% covered and I don't have anything else to pay. So if you guys have any older friends or family members, if they say things like, I go to any doctor I want to go to and I don't pay for nothing. I didn't pay for my surgery. I didn't pay for my copay. I didn't pay for the emergency room or an ambulance. I didn't pay for physical therapy. I'm just covered. Don't let them say they're not paying zero. Think about it. They're paying $174 to the government. They're paying $120 at least to a supplement company. They already met their deductible. They forgot about. So yeah, okay, got it. The rest of the year, they're not paying to go to a doctor, to go to a specialist, or that kind of thing. But it's very far from free, let's be clear. And it doesn't cover drugs. Medicare by itself doesn't cover prescriptions that you give to yourself. Like most people at some point, we take cholesterol medication, or we take blood pressure medication, or we take thyroid prescription. We might take diabetes and insulin. We might take inhalers for asthma. If you're in Virginia, you probably have asthma. It seems like, or seasonal allergies at least. But these drug plans are done by insurance companies. So you don't really get a Medicare drug plan. What you end up getting is a United Healthcare Part D drug plan, or you get a Cigna Part D drug plan, or an Aetna Part D drug plan. Okay. But there's many, many to choose from in each state. I know in North Carolina and Virginia this year, I'm in Virginia personally, but there's 20 available drug plans in Virginia and North Carolina this year. They're going to range in price, of course. So they're not all 30 bucks a month. I'm just preparing you that it's around $30 a month for a typical drug plan. So you might pay Humana 30 bucks. You might pay Cigna 30 bucks a month. They're going to give you a plastic ID card. You're going to take that ID card to your pharmacy. And just like people do now with their current insurance, even with these Medicare plans, you're going to have a copayment for your prescriptions. And the copayment for prescriptions is going to vary depending on the drug tier and the pharmacy you go to. There's a lot in that one little sentence. So these insurance companies rank drugs. So they're ranking drugs first, and they put them in levels called tiers. The higher the tier, the higher the copayment. So there's some people out there who just maybe take 2 or 3 generic drugs, and maybe their copayment is 0. Like they might not pay anything for their cholesterol medication, like rosuvastatin or atorvastatin or orbisartan. They might not pay anything for their blood pressure prescription, like lisinopril or amlodipine or hydrochlorothiazide. They might pay nothing for that. So they tell their friends, drugs are free. No, all drugs are not free. Some of them are very low cost. Some of them are free. Some of them are $1. Some of them are $200 or $300. Some of them are $800. It depends on the drug that you're using. And it also depends on the plan that you get. But nevertheless, you wind up with 3 ID cards. Okay, so with option 1, to quickly recap this, you'd have your Medicare card, a supplement card, a drug plan card. You're paying Medicare about $174, a supplement around $120, and a drug plan around $30. So when you add up all those numbers, it's about $300 to $340 a month for supplement plans for option number 1. And $330 used to be a car payment, a decent car payment back in the day. Now they're $700 or $800 a month for a decent car payment, seems like. But anyway, that's why I say they're like a car. You pay for your supplement, you pay for your drug plan every month, whether you use it or not, just like your car sitting in your driveway. You're paying for it whether you're using it. But when you do use it, you can go where you want, when you want, with no real red tape to talk about. And it's very convenient, but it is more expensive. So hopefully that'll give you a really quick rundown of Medicare, a supplement, and how drug plans work. Next, grab a different sheet of paper because we're going to talk about option number 2. Now, option number 2 came out in around 2006. Actually, came out in 2006, not around 2006. So option number 2 was designed to save money, designed to save the consumer money. So in most cases, not in every case, but in most cases, option number 2 would save most people money long term. It's not like a car. It's like the bus. It's a lot cheaper to ride the bus than it is to have your own car. The bus was never designed to be convenient. It wasn't designed to be super easy. It was designed to save money. So if you go on this program, you only show one ID card. You don't show your Medicare card. Everything is put together underneath one insurance card. This program is called Medicare Advantage. So Medicare Advantage is not supplements. Supplements are not Advantage plans. Now, they have to name everything twice to confuse people, of course. So Part C, like Charlie, is Medicare Advantage. So Medicare Advantage is Part C, just like Medigap was a supplement and a supplement was Medigap. Now, we tell people the letter C stands for combines, because if you notice, you only use one card. So this is combining all those 3 cards together underneath one ID card. It works differently, though. It ain't like a car. You're not going anywhere you want to go. If you go on an Advantage plan, you got to go to the doctors that are covered by that particular company. It's a network of doctors. So if you got a Humana Advantage plan, you got to go to Humana doctors. If you go to United Healthcare Advantage plan, you just got to go to the United Healthcare network of doctors. Okay. So it's like a bus loop. Got to go where the bus goes. And you know, if you've ever used a bus, you have to pay a bus fare, right? So the fee to ride the bus. Well, these are how Advantage plans work. There's a small copayment for every service rendered, just like most people's group insurances. Like if you go to your family doctor, you might pay $5. That's your copay. If you go to a specialist, your Advantage plan, you might pay $30 as a copayment to your specialist. If you go to the emergency room, you might pay $100. That's your copay. If you have a surgery, you might pay $300 to have a surgery. if you go to physical therapy 3 times a week for 6 weeks, you're going to have a co-payment 3 times a week for 6 weeks. It's pay as you go. There's also co-pays for prescriptions, just like before. The co-pays for prescriptions vary depending on the drug tier, exactly like we just talked about before. So even on Advantage plans, you're still going to pay co-pays for drugs. Speaking of also paying, remember how earlier under option 1, we had to pay Medicare for Part B, which was the $174.70, right? So guys, you have to pay for Part B, whether you're on a supplement or whether you're on an Advantage plan. So either way you go, you got to pay the government the $174.70. Now here's where friends and family and coworkers or whatever get confused. That $174.70 automatically is taken out of people's Social Security checks before you get it. So I've heard thousands of times one person tells their friend, I don't pay anything for Medicare. Yes, they do. It's just coming out of their Social Security check before they get it, and they forgot years ago that they're actually paying the $174. But what these people are telling their friends is more about these Advantage plans. Because in every single county in Virginia and every single county in North Carolina, you can get an Advantage plan that doesn't cost anything per month. So that's really what the friends and people are talking about when they say, I don't pay anything for my plan. What they're trying to say is, I don't pay a monthly payment for my Advantage plan. Well, think about it like a bus, right? There's no such thing as a monthly bus payment. There's monthly car payments, but not monthly bus payments. So you don't pay anything for the bus, just like you don't pay anything for an Advantage plan each month. But when you use your Advantage plan is when you're going to have to pay co-payments for services, and you got to go where the bus goes, such as a network of doctors. But think about this mathematically. People who choose a supplement for $120 and a drug plan for $30, the people who are buying supplements and drug plans are paying an extra 120 plus 30, $150 a month for their supplement and their drug plan. And $150 a month times 12 months, I don't know what that turns out to be, probably around $1,800. So instead of paying $1,800 for option 1, some people have chosen to save that money, keep it in their own pocket, get an Advantage plan, while they know if they start using medical services, out of that $1,800 savings, they're going to have to start paying for doctors and hospitals and surgeries and physical therapy and MRIs and that kind of thing. So guys, there's not a right way or a wrong way to do this. It's however you would like to do it, whether you would like option 1 or option 2. The people who choose option 1 are typically the people who say, I've saved up enough money. I want to have medical care that allows me to go where I want to go, when I want to go, without any hassles. I'm not taking the money with me when I'm dead. I'm going to spend a little bit of it on healthcare and health insurance, and I'm going to be really well covered with option 1, not worry about it. Other people might choose, well, I want to try to save as much money as I can, so I'm going to choose Medicare Advantage. And I know that I'll be saving money typically, but the few times I get sick or injured, I'm going to have to pay out some money on my Advantage plan. So again, there's no right way or a wrong way to do it. Now, before I open it all the way up to questions and answers, I want to tell you guys something that's very not well known with Medicare. And this is for about 43 states. So there's a handful of states across America that this does not apply to, but the large majority, especially North Carolina and Virginia, this is the way this thing works, is switching between plans. So let's talk about switching, because this is where people don't get it. See, when you're brand new to Medicare, and you're brand new to Medicare when you're turning 65, or when you're starting Part B, or when you're coming off of a group health plan. Well, that's only 3 times in your life that you're considered new. So starting Part B, turning 65, or coming off of a group health plan. All right. Now, when you're new, both options are on the table. You can choose a supplement or an advantage plan. Every one of these companies has to sell you their plan if you want their plan. United Healthcare has to sell you their supplement. Cigna has to sell you their supplement. If you want a supplement, that would be the time to get it. They cannot ask you any medical conditions or questions, medical questions. Now, if you choose option number 1 first, if you go with a supplement plan in the beginning, the price is going to go up a little bit every year, like everything does. But at some point, if you don't want that much coverage for a supplement plan, or you just don't want to keep paying those rates for a supplement plan, you can always move from a supplement and jump on advantage plans. That is no problem. That's really easy. So I'll say it a different way. You can get off the car and jump on the bus. The bus will always take you, now or later. Or you can start on Medicare Advantage. So you can come on Advantage later, or you can get on Advantage when you're first coming into Medicare. But here's where it gets a little tricky. The rule is once you get on the bus, you cannot get off the bus. Now, there's a few exceptions to the rule, but people should not use the exceptions thinking that that's going to happen to them later. It's just like probably a good financial strategy would not be expecting to win the lottery. I'd call that poor planning, to expect you're winning the lottery. So if people go on Medicare Advantage plans, they have to understand that statistically, once you get on the bus, you cannot come off the bus. You can change seats on the bus. That is no problem. So if you didn't like your United Healthcare Advantage plan and wanted to go to Humana plan, great. You can change to Humana Advantage plan. If you didn't like Humana's Advantage plan and wanted to go to Cigna's Advantage plan, great. You're still on the bus. You just change seats on the bus. You just go from the Humana doctors to the Cigna doctors or the Blue Cross and Blue Shield doctors. You still pay copays. You still have a network of doctors. You're still on Advantage plans. But I would say that last little bit right there is what a lot of people don't quite understand most of the time. They think when they're super young and super healthy, they can jump on Advantage plan, save some money, and then later on, when they start getting sick or injured, they think they can just go back and get a supplement later. That is not how that works typically. So people just have to understand, once they go on Medicare Advantage, they're probably not going to be coming off Medicare Advantage. Okay, so as this screen goes black for a second, then I'm going to talk a little bit about dental and vision, because I usually get a lot of those questions about dental and vision. And if you think about Medicare, just like the health insurance at work, then it's basically the same thing. At work, if you wanted health insurance, you bought health insurance. If you wanted dental, you added dental. If you wanted vision, you added vision. If you wanted disability, you added disability. If you wanted anything else, your paycheck's going to be almost nothing by the time you add all these things into your paycheck at work. Same thing with Medicare. Medicare is just the health insurance side of things. If you want to add dental, that would be a dental insurance, which would be separate from what we've talked about. If you wanted vision insurance, you'd have vision insurance, which again would be separate. It's a separate bill, separate payment, that kind of thing. I would tell you vision insurance is pretty much worthless outside of a group health plan. If you're covered by vision at your job, perfectly fine. But I've never really seen a truly mathematical appropriate vision plan for a retiree. As a dental, I would recommend people buy some dental insurance as a retiree, because I can tell you that does actually have a pretty decent value proposition to it. So If somebody's looking for dental, I would also say not a bad idea to have dental insurance. Okay, so that is the whistle stop Reader's Digest version that I can give you about Medicare. I don't know how much longer I can use Reader's Digest as an analogy either, but at the end of the day, hopefully that was helpful in understanding the main differences between the programs. And the two main programs are supplement plans or advantage plans. And that's really what you'd have to make the main decision on. So Assad, I'll open that up to you and see if there's anything in the Q&A or if people have any questions.
Yeah, so thank you. First of all, this is very informative, very helpful. So thank you for that presentation. As a reminder, the chat is disabled, but you can submit questions through the Q&A button. So if anybody has any questions they would like to ask, please feel free to go ahead and add it to the Q&A. While people are thinking about that, Bryan, we've had meetings before with clients of ours where you kind of take a look at their situation, ask questions. Maybe you can kind of describe how those meetings go, just to give people an idea, because it is something we recommend for our clients, at the very least, to look at where they are right now, what they're doing. Does it make sense, or are there solutions out there that make more sense for their situations? And I can tell you, we've had meetings with Bryan where we look at the situation, we look at what they're doing, ask some questions, and what they're doing makes sense. In the future, maybe they want to make a change, and Bryan uncovers some opportunities there. We've had some situations where, through Bryan asking questions, we found out that there are better solutions that people had no idea that were available to them. So, Bryan, maybe just spend a little bit of time about kind of how the meeting would go and the information that you need and how we go from there.
Yeah, that's easy. So I'll start with what is typical, right? So if I could have my preferences, if people would call us about 3 to 4 months or 6 months before they turn 65, because if we can catch people before they're turning 65, we can give them advice based on what their current expectations are. Like, are they expecting to work for another 2 years or 1 year? Are they expecting to quit in 6 months when they turn 65? So we can kind of get ahead of things, and we can kind of start giving them what I call the escape plan, the work escape plan, the retirement plan. So we can kind of figure out, on this month we should do this, on that month we should do that, when it comes to transitioning from a group plan or just a regular individual health insurance plan over to Medicare at age 65. It's not advised to try to figure all this stuff out the week before you turn 65. That would not probably be the most appropriate. Okay. For the people who plan, do start planning 3 to 6 months to no less than 3 months before you start turning 65. Now, if somebody is already a retiree and they're not covered by an active employee's group insurance, like a person I was talking to this morning, he's actually retired. His wife is a year younger. She's working. He's covered by her group plan. But because she's still working and that group plan is affordable and a good group plan, he doesn't need to do anything with Medicare because he's covered by her group plan and she's still working. Now, so this morning I told that person, don't even sign up for Medicare. He doesn't need it. He's fine. He's covered by his wife's group plan. When she's starting to go to retire, let me know, and we'll start that transition over to Medicare. But we work with a lot of these municipalities all over Virginia, North Carolina. So a lot of these county governments, when their employees are retiring, they'll send them to us for help. Well, some of these counties, their spouse rates are pretty high. So I'll give you an example. If you guys are not around Virginia, this won't make any sense, but there's a giant school system in Chesterfield County, Virginia. And I'll just make the analogy like it's me and my wife who work there. Okay. So I'm a nurse, so she doesn't work in the schools either. So, but if my wife worked at Chesterfield County, she'd only pay $100 a month for her health insurance. That's a pretty good rate. $100 a month for pretty good health insurance. But if she added me to that insurance at her school, it raises her rates up to $780 a month. So just my portion of the group plan would be costing our family $680 a month. So you think about that, and you think about husband and wives who are on their group plans together, and maybe one of them is not going to retire. But if I turn 65, I'm not going to stay on my wife's group plan if the group plan is $680 a month. I'm going to jump off of that group plan. My wife can keep working, but I'm going to come off the group plan. I'm going to come over to Medicare. And even if I went with a supplement plan, that's around $300 to $300 a month, $330 a month. So I would be saving our family so much money and having better insurance, because option number one is awesome health insurance. Let's just call it what it is. So in that scenario, those are some of the things that we look at and see, is it time for somebody to come over to Medicare? Is it not time for somebody to come over to Medicare? And if it's not, I will tell them why it's not the right time for them to come. If it is the right time to come, then I can explain why it is the right time for them to come over to Medicare. So, we do have some questions. Good job, guys. There's always, is it Myrna? Is that how you pronounce it? I am terrible.
Joy.
Joy. Okay. Thanks, Joy. Sorry, Joy. Thank you for asking the first question. You're the best. All right. So the first question in the Q&A box is Medicare Advantage transferable within the states? And what about outside the United States? Example, traveling. Okay. So Medicare Advantage, remember how it's like the bus, right? So we're talking about transferable. So if you lived in Chesterfield County, Virginia, and you are on an Advantage plan, you can use your Advantage plan with your current network of doctors. Most of these Advantage plans, not all, most Advantage plans have a local network of doctors that you can choose from. So if you were traveling out of Virginia and you were in Wyoming and on an Advantage plan, you'd basically have emergency room coverage only for the most part. So I would say if you're on an Advantage plan and you're traveling in the United States, go to an emergency room. Don't go to any urgent care. Don't do anything else. Just go to the emergency room, because there'll be better chance of it being covered correctly going to an emergency room when you're traveling on an Advantage plan. But that's if you live someplace and you're just vacationing. If you move, totally different animal. It is not transferable. So if you moved from Chesterfield County, Virginia, and you moved to Loudoun County, Virginia, you got to get on a different bus, right? Because the Advantage plan that you had in one county might not move, probably won't move with you to a different county, especially if you move different states. So if you're on an Advantage plan in Virginia and you moved to Florida, then you're going to need to pick a different Advantage plan in Florida if you want to stay on Advantage plans. That's the key thing like that. So it's not really transferable if you're moving your physical address. And then the question continued about outside the United States. Guys, I have had so many customers get killed, not killed, like they just die. They didn't actually get killed, but they died overseas, or they've gotten sick overseas, whether they got injured or sick. My last guy actually had a stroke in India. He was in the hospital for 3 weeks. His wife had to fly from Virginia out to India to help him. Well, guys, if you looked at your passport on page 6, it basically says, if you have Medicare, don't even take your Medicare card with you if you're traveling overseas. Obviously, that's paraphrased, but it just says Medicare won't work. And that's true. The red, white, and blue Medicare card is not going to work at all overseas. Now, remember how I talked about supplement plans, which are also called Medigap plans? Certain Medigap plans, certain supplements, do have overseas coverage, but it's reimbursable, meaning they're not going to pay anything to the doctor in India or that hospital in India I just gave you the example of. So the customer that we had, he actually did have a supplement plan. Well, the bill over there for 3 weeks in the hospital was only $20,000, by the way. So his supplement plan, Joy, will reimburse him 80 cents on every dollar up to $50,000 lifetime benefit. So I don't know what 80% of 20,000 is, but 16,000. So his supplement plan will reimburse him $16,000 out of the 20,000 he had to write a check for while he was over there. Which brings up a good question about traveler's insurance, right? So we don't do traveler's insurance, but I would recommend if people do overseas travel, they probably should they should get some little bit of traveler's insurance. I mean, the largest bill I've ever seen of people overseas medical is $25,000. So most people's bills, even pretty big problems, it's just not the same amount of money overseas that it is here in America, kind of thing. So hopefully that answered that question, Joy. The next question is, what's the cost trend in the past few years? $174 today. What's it expect to be in the future? And who assigns this price? Okay, that's anonymous. So anonymous. So what's the trend? That trend is really easy to look up. If you wanted to look that up, you would just do this, you would Google, historical Part B, as in boy, monthly payments. And usually it doesn't go up by much, So like last year was 160 some odd dollars. The year before that, it was $148. The year before that, it was 100. So it typically goes up, well, before COVID, it was going up by $2 or $3, a time. The last few years, it's gone up quite a bit. I mean, when I first started in this business, it was 80 something dollars. So, in 20 years, it's, doubled. But I would say a typical increase for Medicare is around, $5 to $10 every year it goes up. And the government sets that. So the federal government releases the Medicare Part B monthly premium payment around October through late part of November. So that October, November timeframe is usually when the government releases that data.
It's also adjusted for income, right, Bryan?
Yeah, good question for there. Yeah, for people who do well financially, they're kind of used to getting jammed by the government. So what happens is for people who have worked real hard, made good money, and also continue to make really good money in retirement, if your household income as an individual right now is over about $103,000, then the government's going to try and charge you more for Medicare. But that's an income related thing, not a everybody kind of pays it. If you're a married couple and the married couple was making more than $206,000 a year, then yes, the government's going to come in and try to charge those people more money because they do well financially. So the more money you make, the more the government comes and takes from you. Big surprise. So, but everybody has to pay that base rate of $174, and those rates and even those income brackets and the income extortion charges, those are all set by the federal government. If you can tell how much I love that, I can tell you. So let's see here. Can you recommend a dental insurance? So the question is, can you recommend dental insurance? The best way to buy dental insurance, guys, is actually talking to your dentist's office manager. Ask that office manager who or what insurance company they are in the network with. The network benefits are huge with dental because they have a contractual rate. Okay. So like, for instance, I just had to have another crown put on back in November last year. Well, my dentist is in the network with a company called Delta Dental. Okay. So I bought Delta Dental because my dentist is in the network. So there's a contractual rate that my dentist has agreed upon with my insurance company. So that crown, the dentist wanted to try to charge me $1,800 for this crown. They're not allowed to charge me $1,800 because the negotiated rate with Delta Dental was only $1,000. So just having the insurance saved me $800 off the top. And then my plan, that Delta Dental plan, paid 50% for the crown, and I paid 50% for the crown. Well, 50% of $1,000 is $500. So out of a would-be $1,800 bill, all I paid was $500. So that's why I recommend dental insurance, is mainly also just for the negotiated rates. But I would check with your dentist, figure out which plan they're in the network, and then call that particular company like MetLife Dental, Blue Cross Blue Shield Dental, whoever it is. And before anybody goes into any spiels about dental insurance, just make sure when you're talking to the dental insurance company like Delta Dental, ask them to look up your doctor first to make sure the doctor is actually in the network. It's the old saying of trust but verify. You should trust your dentist's office manager that they know what they're talking about. Sometimes they don't. So verify that they're actually in the network with the insurance company before you buy that insurance company's policy.
I'll add one more thing to that is that if you do know that you're going to need major dental work, not immediately, maybe next year, or maybe you're thinking about it in a couple of years, there are different dental coverages that cover, more major procedures better than others, and so you should do some research about that ahead of time and try to get a plan that will cover more of that work. But you need to do it in advance. You can't just go to the dentist, do it, and then go to dental coverage at the dental insurance company and say, "Oh, I want this coverage now because I need this work." Of course, they won't do it at that point. So you need to do a little bit of planning ahead for that.
Absolutely. Yeah. So to kind of piggyback on that, there's things called waiting periods. So if you don't get the plan that you really would like to have and you wait, then the insurance company can also wait to pay, because they're insurance companies. They kind of get it figured out a long time ago that people will, try to buy insurance on Friday because they chipped their tooth on Thursday, and they will, give waiting periods for that kind of deal. So just make sure, like you said, definitely want to get that ahead of time. So then Bruce asked a question: would you be able to give a similar seminar to this one for federal government employees? Yes, I could do that. I think it would be better as a one-off kind of thing, Bruce. So if you did have questions about it, to me, we just don't get a lot of federal retirees. It's probably, I don't know, like 3 or 4 a month. I personally am terrible with technology, so I'm not really good with this stuff. Haley and Saad put all this stuff together because that's way above my technical prowess. But if you had questions about it, then yeah, just give me a call, give us a call, and I can very quickly and easily help you understand from a federal retiree what the benefits are, how they coordinate with Medicare, and kind of what your options are for that kind of thing too. So be happy to explain that. And then Roush asked, can you recommend the best supplemental insurance? I can't really recommend an insurance company because that's going to depend based on your age and zip code and gender, because that's what we do. We look at all the different insurance companies out there. And in one area, United Healthcare might be way better than Humana. But then other areas, those two companies are terrible, and Blue Cross and Blue Shield is by far the best. So we'd have to kind of look at your particular area. But these supplements are done by lettered plans. So you get a Medicare supplement plan F, or a Medicare supplement plan G, as in George, or an N, like November. So the supplements are done by lettered plan. So I can tell you that if you're going to do a Medicare supplement plan, you should really do a plan G, as in George. Now, if you look on Google and YouTube and all that stuff, people are going to have their own opinions. Plan G would be the smart move to make. So if you do a Medicare supplement, you should really look hard at Plan G and probably ignore the rest of them. And it's regular Plan G, not the high deductible Plan G, just a regular old normal Plan G. All right. And then Bruce, you guys are asking good questions here. Bruce said, I thought I had to sign up for A, when I turned 65, I am still working and have a group insurance. Yeah, Bruce, that a lot of people are told that. So we're talking about people who get told to sign up for Part A when they're turning 65, even when they're currently covered by a group health plan. You don't have to do that. So, Bruce, if you did it, it's not a big deal. You can't get out of it now. You're in it. So they literally won't remove you from it. But it didn't really do you any big favors and it didn't really hurt or help. But as long as you are still covered by a group health plan and the company has more than 20 full-time employees. So if somebody works for a really small company, like me, like my company, we have 7 employees here at Boomer Insurance Group. So Bruce, if you came to work with us, you'd be bored to tears, but you'd also have to sign up for Medicare because we have such a small employee group. But you might probably work for a bigger company. So if you work for a large company of more than 20 employees, you did not have to sign up for Medicare at all. You didn't have to sign up for Part A. And there's really no penalty for Part A because, guys, the only way to get penalized for Part A, like if you didn't sign up for Part A at 65, the only way to get penalized is if you personally did not work for 10 years. And I didn't say 10 consecutive years, I just mean 10 years. It's called 40 quarters. So as long as Bruce has worked for 40 quarters or 10 years, it's impossible for him to be penalized for Part A. Now, if he never worked a day in his life, but he was married to somebody, and the somebody he was married to, if they worked for 40 quarters or 10 years, well, Bruce, you still wouldn't have to sign up for Part A because your spouse has enough credits that you could get Medicare Part A underneath their work history. So while you didn't have to do Part A, it's not really big or not big that you didn't do it, that you have it. I would tell you not even carry your Medicare ID card with you. Just leave it at home and not even carry it with you unless you're hospitalized, because it won't work unless it's an inpatient thing. All right. And then Kathleen, one of my favorite names, when traveling overseas, how does reimbursement work for Advantage plans? Very poorly. So Kathleen asked, when traveling overseas, how does the reimbursement work for Advantage plans? Well, if you notice, Kathleen, I didn't mention anything about Advantage plans, kind of on purpose, because the supplement plans are really easy to get reimbursed. The 80 cents on every dollar. I mean, it's filling out one form, giving them receipts, and no problem. The Advantage plans are a little more different. So we've tried to get reimbursed a few hundred times from Advantage plans. And as much as we've tried, we haven't really got very good traction on trying to get reimbursed for people's expenses overseas when they were on the Advantage plan. So if somebody chooses an Advantage plan and they travel overseas, I would say it's even more important for that particular person to get traveler's insurance. Yeah. Just because it's quite difficult to get any money back from an Advantage plan overseas. Let's see. And then the last one, Veronica says, have you been a part of any discussion on plans to get rid of original Medicare with Advantage plans being your only option? Ooh, that's a loaded question. What do you do for work, Veronica? So somebody's been doing some reading. So the question again is, have I been part of any discussions on the government trying to push everybody over to Medicare Advantage plans and basically doing away with option number 1, or doing away with just regular red, white, blue Medicare? So they don't outright come out and say that, but there's a little bit of writing on the walls when it does come to what the industry is moving towards. If that, I got to speak a little cryptically on this subject. But what happens is all the advertisements, all the direction is basically pushing people more towards Medicare Advantage more and more and more. And a lot of the rules that are changing are more biased, I would say, towards Medicare Advantage plans. And I can give you a quick example of that. They just made a huge, huge change to the prescription drug coverage for next year. And with this new law that just goes into effect January, with the Biden's Inflation Reduction Act, then it's putting a pretty hard press on these individual Part D drug plans, like I mentioned earlier, underneath option number one. Right now, those plans are about $30 a month. They'll probably not be $30 a month for much longer. So they'll probably be much more expensive in the future to have just a regular drug plan. Well, if people are already paying so much for a supplement, and then the drug plan itself starts getting up into the $80, $90, $100, $150 range, it's going to mostly price people out of option number one, unless they've just done very well financially. Then they might not be able to afford option number one long term, which will kind of financially push them over to the Medicare Advantage plans as kind of their only option, so to speak. So that's where the industry is heading. I can't really say the government itself is going to be doing away with original Medicare, but maybe. I mean, I'd say. Hopefully that answered that question too. Okay. There's no more current questions, so I'd be happy to answer any other question. Otherwise, you guys can get in touch with Assad and Haley about contact information if you guys have any additional comments, or it'd be wonderful if you did have a good experience, if you'd send them an email and say that this was worthwhile. If you had a bad experience, just forget about it altogether. But other than that, I hope it was of value and you guys have learned some things that you didn't know before. So I'll turn it back over to you.
Yeah, Bryan, thank you so much. As you guys can see, Bryan really knows this information cold and has helped so many people out there, but so many of our clients as well. We are happy to set up Zoom calls with Bryan to go over individual situation of any of you on a call, or if you know anybody else that can use help or wants information, we can also set up future webinars like this. If you have a group of people that wants to do it, let us know. But again, what we try to tell our clients is, hey, let's set up a Zoom with Bryan, because we don't know what we don't know, and that way we can find out what your situation is and see if there's a place where we can improve it. And Bryan, again, is always very knowledgeable, very gracious in answering all questions. So thank you, Bryan, so much. Thank you, everyone, for attending this webinar, and have a great rest of the day and a great weekend ahead.